It's cool how your mouse moves.
I think so. I know it's not me. Oops. All right. So just start. You're totally fine. Just start with a visual inspection of your head, and then I'm just going to don't notice any swelling, bumps, or bruises. That's perfect. Go and smile for me real quick. Beautiful. Okay. And if you don't mind, I'm going to start palpating, touching. Is that okay? Very cool. Just palpating for any what they call step downs, or lesions, swellings. Any of this hurt? No. Okay, look at your hairline.
Oh, yeah, I've got like something. Sorry.
Oh, it's okay. That's all right. That's okay. But no hair loss. No like alopecia, hair loss. Cool. You wear sunscreen? Perfect. You try to. Perfect. No, I wouldn't say any hair loss. So if it's normal like that, I'd say the head is atraumatic and normocephalic. So you have a very normal, nice face and head. Is that good? All right, perfect. So no lesions or tender areas have been noted. I'm then going to start by palpating your temporal arteries again. Okay. Both equal and bilateral, which is wonderful, normal finding. And we keep on scrolling down now. TMJ again, so down to your jaw. Okay. Any tenderness? Okay, you're going to open and close for me. Once more. Perfect. So normal range of motion, no popping or crepitus noted. That's awesome. Okay. Any difficulty swallowing or anything? That's perfect. Do you ever wear braces?
No.
No? Perfect. All right. TMJ is without tenderness and normal range of motion, no crepitus noted. Any sinus issues or sinus pressure you're aware of? No? Okay, I'm going to start by touching your frontal and then your maxillary sinuses. Is that okay? All right. And tell me if you feel anything. Painful? Pressure? That's your frontal sinuses. Maybe pads in your thumb. Sinuses. Anything? No? Perfect. All right, we like that. We like that. Okay. Okay, then I'm going to start by assessing cranial nerve 5, okay? And cranial nerve 5 has both motor and sensory function. Is that all right? So for motor function, I'm going to, again, place my hands on the side of your jaw. I'm going to open and clench down kind of hard. Perfect. And kind of clench and unclench. Perfect. That's perfect. Okay, cranial 5, nerve 5, motor is intact. And then for cranial nerve 5 sensory, I'm going to have you close your eyes so you can't see me. And I'm going to touch you somewhere on your face. And you're going to tell me left or right and where I'm touching you, okay?
So right cheek.
Perfect. And
then chin.
Perfect.
Left cheek. Forehead. Center.
Nose. All right, so cranial nerve 5, both motor, I'm sorry, both motor and sensory are intact. All right.
That's good.
Okay. Cranial nerve 7. So I'm going to assess like your facial function. Can you puff out your cheeks like a chipmunk? Perfect. And smile real big. And then can you raise your eyebrows? Cool, and then squeeze your eyes, tight, really perfect. All right, so cranial nerve 7 is also intact. I'm next going to move on to your eye exam. So first, I'm just going to visually inspect. I don't notice any what they call injection of your sclera, the white part of your eyes. No foreign bodies. No anything, no crustiness on your eyes there. Any eye pain? No? Perfect. All right, cool. I'm going to get my otoscope and ophthalmoscope here. I'm going to shine a light into your eye, if that's okay. And I'm just looking for pupillary reaction. No, it's okay. Okay. I should fall off there. All right. Just going to stare straight ahead for me. So I'm looking for both a consensual and a indirect reaction. So over here. Perfect. Normal pupillary response. direct and consensual. And I'd say your pupils are perla, equal round, reactive to light and accommodation, and about 3 millimeters in diameter, which is excellent. Both consensual and direct light reactions. I'm then going to test more cranial nerves, if you don't mind. So it's going to be cranial nerve 3, 4, and 6. Okay, and that's going to be you holding your head, kind of stare at my forehead here. So follow your fingers. Sorry, follow my fingers with your eyeballs, but don't move your head. Okay. Go kind of like an asterisk like pattern here. Oh, cool. And I'm going to go towards your nose, okay? Keep cross-eyed. Perfect. All right. No, okay. So I can say positively and with confidence that cranial nerve 3, 4, and 6 are all intact, and you do wear glasses, correct? Okay, perfect. I'm gonna have you put on your glasses for me. Oh, sorry. Okay. And then use this. Go ahead and cover your left eye real quick, and then tell me which line on the Snellen chart. Can you read number 5?
PECFD.
Perfect. And how about number 9?
LEFODPCT.
Perfect. And then cover up your right eye for me and try number 7.
FELOPZD.
Awesome. And how about number 9?
LEFODPCT.
Perfect. Okay, so with glasses you have 20/20 vision. Awesome. Right, yeah, that's right. Thank you. All right, and then can I start by looking in your eyeballs again before these go? All right, perfect. All right, and look for that red reflex, and I'm gonna look for some blood vessels, arteries, the retina, optic disc, and optic cup. Okay, don't move. Great red reflex. Let's see, optic disc, optic cup, remoted. I'm trying to move a little nasally here to see your macula and fovea. No abnormalities noted. And that optic disc to optic cup ratio is 3:1. You doing okay? Go over here now. Great red reflex again. I can see optic disc, optic cup. Macula and fovea. Good ratio. 3:1. You okay? Just blind you? Okay. Awesome. Thank you. We'll keep moving down here. All right. I'm going to do your ear exam, okay? All right, so we're just going to start by visually inspecting, of course. I don't notice any bumps or redness. You do have pierced ears, yeah? You said you wear sunscreen, but I don't see any like lesions or sores. Awesome.
No facelift.
No facelift. Yeah, no scars. I'd see the scars in your hairline. Perfect. Okay, and I'm gonna do what we call a whisper test. So go ahead and occlude that right ear for me. I'm gonna whisper 3 things, okay? Cat, dog, mouse. What did I say?
Cat, dog, mouse.
Perfect. All right, you can cover your left ear for me.
137.
Perfect. All right. So whisper test is good. That's going to be assessing cranial nerve 8. Okay, and we're also going to do the Weber and Rhine test again. Is that all right? All right. So I'm going to strike this little tuning fork. I'm going to place it on the center of your forehead. When you can no longer hear it, go ahead and raise that left arm. Okay. Perfect. All right, that's to assess bone conduction. All right, good job. Okay, so that's good. That's not what air conduction is greater than bone conduction. We're just going to compare sides here. Awesome. All right, cool. That is a normal Weber and Renee test. Air conduction is greater than bone conduction. You okay if I look inside your ears again? Okay, perfect. Okay, so when I'm looking inside your ears, I want to see that tympanic membrane. There's also a couple bones I'm looking for, the incus and the malleus. I want to make sure there's no perforations in your tympanic membrane. Perfect. I'm going to kind of pull up and back, be very gentle. Don't let me hurt you, okay? On the corner of your ear here. Oh, yeah. Tympanic membranes, nice pearly gray. I can see that incus and malleus bone. No, I do not see any earwax or some buildup, so that's good. All right. You okay?
You're like, ow.
I know, because you were saying you think you're hard of hearing.
Really good.
I don't think so. All right, this one too, is that okay?
Mm-hmm.
Okay. Okay. Okay, no. Nice pearly gray tympanic membrane. See incus and malleus bone. No perforation in the tympanic membrane. It's not red or bulging, so no ear infection. But you do have a little more earwax on this one, like we said. Okay, you okay? Did I hurt you?
Alright.
No, okay, perfect. All right. All right, so after the ears, we keep on going down. I'm going to visually inspect your mouth. Is that okay? All right, cool. Any like problems with mouth sores, canker sores, chapped lips, anything like that?
No, I just
No?
sometimes get chapped lips, but otherwise it's tonsil stones, I think.
Oh, really? Okay, perfect. Sorry. So everything visually looks just fine. Okay, perfect. And then after visual inspection, do you care if I shine that light back into the back of your throat and look at your tonsils?
Go for it.
All right, cool. You ever had your tonsils removed? No, you have your tonsils. Perfect. All right. Open up real big for me. You can stick your tongue out. Cool. I'm gonna get a tongue depressor. Is that okay? All right. Don't let me hurt you. New, never been used, I promise.
Beautiful.
Alright, let's stick your tongue out again for me to put this on your tongue. Very good. Okay, now. Got 16 teeth on the top. Put your tongue back in. 16 teeth on the bottom. I can see the anterior and posterior pillars of your mouth. And no, I'd say your tonsils now. Any soreness or anything sore throat? No, okay, your tonsils are probably grade +1, which is normal. No difficulties swallowing or anything.
I just get pops when I swallow.
Pops?
Yeah, like pops in my ears.
Oh, okay, kind of like pressure, like also like when you're in a plane. Interesting. All right. Huh. I wonder if that
Like right now?
Like now, popping? No. Okay, let's see. I'm gonna assess cranial nerve 9. I'm gonna look for your palate and your uvula for elevation. Is that okay? All right, so go ahead and open up again. Say ah. Perfect. Once more. Ah. Oh, you do have a tonsil stone back there. Oh, I see. Okay, say ah again. You do. It's a little bitty one. Yeah, it's on your right side. Okay, it's okay. I don't think I can get it out for you, but it's just a little itty bitty one. Okay, it's back there. So, a soft.
Sorry, not to see
It's
that.
okay. Soft palate rises symmetrically. The uvula is a midline, so there's no deviation. So I would say cranial nerve 9 is intact. And instead of gagging you to assess cranial nerve 10, can I ask you to take a sip of water for me?
Sure.
It's a little itty bitty one though.
Oh, that's fine. Oh, I thought you were
It'll give you us water, let's see.
talking about the water.
Okay.
Okay.
Go take a drink for me. You saw it?
Mm-hmm.
Beautiful. Watch that throat there. Okay. Let's say you have a intact cranial nerve 10 there. And then I'm going to assess cranial nerve 12. Let's stick out your tongue. Perfect. Tongue is midline, no deviation to left or right side. Okay, thank you. Oh my gosh. Okay. Now I'm going down to your neck. Is that all right?
Mm-hmm.
Okay, so I'm looking for any issues with your thyroid in the past? Yeah? No?
Just when you get sick sometimes.
Okay.
They're a little swollen.
Or like the lymph nodes enlarged?
Yeah.
Okay, but no issues with thyroid. You're taking any thyroid medication?
Correct.
Something like that. Okay.
Yeah.
Okay, I'm just looking at your trachea. Trachea is midline. If it was deviated, I'd be concerned about like tension pneumothorax or anything. Okay, beautiful hair. Any neck pain you can tell me about? Nothing like that? All right, so visual inspection looks great. Okay. I'm going to start looking at your lymph nodes, okay?
Mm-hmm.
So the pre-auricular lymph nodes are going to be coming right here. I'm just feeling for any enlargements or abnormalities. Okay, and then the posterior auricular lymph nodes. And then occipital at the base of your skull. A little more posterior. Okay, and then your tonsillar lymph nodes. You doing okay?
Mm-hmm.
Submandibular and just moving forward. And then submental, that's the guys right up here on your chin.
Mm-hmm.
And then go down your neck, okay?
Mm-hmm.
To your anterior. Okay. And your superficial and your deep ones, there's a lot of them.
I know.
Okay. Any pain back there? And then your subclavicular can be kind of like that. You know.
Well.
All right, then I'm going to have you close your eyes.
Mm-hmm.
Can you turn your head to the left for me? Perfect. And then go ahead and turn your head to the right. And then go ahead and shrug your shoulders for me. You shrug? Perfect. So I can also say a cranial nerve 11 is intact. All right. Thank you.
So cool.
Oh my gosh. Okay.
Yeah,